The University of Minnesota is using the Affordable Care Act as an excuse to try to shift costs of healthcare onto the lowest paid employees. And we are here to say that is wrong. The state didn't do it. There's no reason why the university should have to do it. People have fought for healthcare, and I applaud Local 3800, 3937, 3801, and 3260 for standing up for this right. It's a fundamental right, and we all should stand in solidarity with them. And it's a courageous and honest fight, and we all should stand there with them and keep up the fight, brothers and sisters.
Today because we all know that the University of Minnesota that we see is not the university that it claims it is. It is not a university invested in public education for a public interest. I am struck by the fact that time and time again the university continues to put profits before people and move forward in decisions without consulting the workers who make this institution what it is.
They want to make us pay more while they pay less and pocket the difference. Where will that money go? Where will that $1.8 million go? If the past 10 years is anything to go by, it will be used to continue enriching those at the top. They say that they have to do this because of great concern to the taxpayer and to students and costs overall. Well, I ask, where was their concern for the taxpayers, for the public, for students, when the university doubled tuition in the last 10 years? When the university spent $2.8 million last year on severance and leave packages for a dozen senior administrators. $2.8 million for 12 people, or $1.8 million for the 19,000 employees who work here. What's fair about that? Suddenly, however, there's a great concern for the taxpayer. Don't be foolish. Truly accountable to the people of Minnesota. After all, that's what we have been doing since we organized our union here 20 years ago. Now, it's an incredible honor today to introduce a special guest, Brother Billy Bragg, an internationally renowned singer and songwriter. But more importantly, when we sent a message on Facebook saying, Billy, we've got a rally at the university the day that you're playing in a sold-out show at the Cedar Cultural Center, we're really waging this huge fight on health insurance. Would you join us? He immediately said yes. And that's a show of solidarity. Brothers and sisters, Billy Bragg!
Thank you very much. I want to say a big thank you to Shireen and Axtree for inviting me to come along here today and play a few songs for you. I know how your society prizes individualism, but we too prize individualism in Europe and the rest of the world. But we believe that unless each individual is the recipient of free healthcare, free education, decent affordable housing, proper pensions, then only the rich and the powerful will get to express their individualism, and the rest of us will be exploited. It's not going to come out of the mainstream. Those people, sadly, I think are too in-hop to big business. It's going to come from exactly the place it came from in my country. It's going to come from organised labour. There is power in a union. There is power in a factory, power in the land, power in the hand of the worker. But it all amounts to nothing, together we don't stand. There is power in a union. Now the lessons of the past were all learned with workers' blood. Mistakes of the bosses we must pay for. From the cities and the farmlands to trenches full of mud. War's always been the boss's way, sir. The union forever defending our rights. Down with the black legal workers unite. With our brothers and our sisters, together we will stand. There is power in a union. I long for the morning, the day realise brutality and unjust laws cannot defeat us. Who'll defend the workers who cannot organise when the bosses send their lackeys out to cheat us? Money speaks for money, the devil for his own. Who comes to speak for the skin and the bone? What a comfort to the widow, a light to the child. There is power in a union. A union forever defending working our rights. Down with the black leg workers unite. With our brothers and our sisters, together we will stand. There is power in a union.
A very favorite and often repeated saying in my family was this: workers who do not join hands and stand up to their bosses will surely wind up naked. While various family members did encounter problems with unions in terms of racial and gender bias, among other things, they and I have always believed in the power of the people united and the righteousness of demanding fair wages and reasonable working conditions. In these times, a union discourse that truly represents the most diverse working force in the history of the United States will be the only way to lessen the current income disparities.
The musicians of the Minnesota Orchestra support your fight for affordable and accessible health care. We applaud your efforts to achieve a fair sliding scale premium plan, to stop cost shifting to employees, and have a full discussion of the options to minimize health care increases that will affect all University of Minnesota employees. As of next Tuesday, the musicians of the Minnesota Orchestra will have been locked out for 1 full year without pay and benefits. Our banker-led board and management proposals have insisted on 30 to 50% pay cuts. Healthcare cost increases that would amount to $5,000 to $8,000 annually per musician, and more than 250 changes in our contract. Their new business model shifts priorities away from our internationally acclaimed performances of classical music towards entertainment presentations, leaving a severely diminished orchestra to represent and serve our community.
Not let the university or anybody else use the Affordable Care Act as an excuse for making health care less affordable for people. Instead, let's turn our energies, 1, to winning this fight here today, and 2, we're planning to build, and there are people in the audience with clipboards on Minnesota Health Plan, single-payer health care. We plan to push that in the year 2015. Not this next session, but the year after. We plan to push it. We need AFSCME and all the unions and all of you and the university and everyone else to say, you know, if we want to bring down health care costs, we're not going to do it by shifting it to somebody else. We're going to do it by getting rid of health insurance and start delivering health care for all instead.